independent living. The attached paper prepared by the DDAN Employment Group on legislative reforms on New Jersey workability contains the rationale for our advocacy, as well as some information on other states' Medicaid buy-in programs. The DDAN Employment Group is compiling letters of support and testimonials from advocates, families, and stakeholders to be presented to our state legislators. Given the current expectations of prolonged periods of high unemployment due to the pandemic, we are urgently requesting that a letter of support addressed to the New Jersey legislature be sent to us as quickly as possible. Making New Jersey workability more accessible to people with disabilities would remove a major disincentive to work and impediment to career advancement, thereby allowing them to contribute their full potentials to our state's economy, to enjoy greater financial stability, and to lead independent lives. Respectfully submitted on behalf of the DD Employment Group. Thank you, Anthony. I will entertain any comments on this. I know this issue has come up numerous times from advocates as well as families, fearing that unearned income, which, yes, it's income, but why should it be treated separately or differently from earned income? And the issue of the difficulties that individuals face if they are on New Jersey workability and their job is terminated, that they're not given time to stay on the program while they search for a new job. And if they lose Medicaid, it really requires them to give up the job search and try to return to standard Medicaid. So I would hope that the council could follow up on this request and send a letter on our letterhead supporting this. But I'll entertain comments from anyone else.
As the current vice chair, I just wanted to say thank you, Anthony, for your very thoughtful remarks. I thought it was very well laid out. The request was very eloquent and straightforward. I think the council could definitely look into this matter further and adjust accordingly to see how we can assist them.
Thank you, Kevin. Well said. I guess we can pick this up as soon as the next executive committee meeting, and I would intend that we would do exactly that. Okay, the second the second comment comes from Dr. Bruce Edinger. He is the executive director of Spectrum 360, which is a provider agency. I know they run a school, they provide day programs, and I believe they also have residential programs, but I'm not sure of that. Anyway, this pertains to the payment for day programs during the pandemic. I'm writing this on behalf of Spectrum 360, which has a day hab program called Independence 360 for over 125 adults on the autism spectrum and with related disabilities, and on behalf of the Coalition of Adult Providers in North Jersey, representing over 20 other day hab programs. We are very concerned that due to the current funding system from DDD for day programs, that they could be in jeopardy of not being able to continue. On March 17th, all programs closed due to COVID-19. DDD provided 100% retainer payments through March 31st and provided 75% until July 17th to help pay expenses and maintain staff. The federal match ran out on July 17th, putting providers in jeopardy. While residential providers received an additional 20% payment, day-only providers did not. DDD then had to lower retainer payments to 50%, making it impossible for providers to stay afloat. DDD has allowed providers to bill for remote services. However, it is based on billing of 15-minute increments. To receive 100% billing, adults would need to be on virtual for 6 hours per day, which is impossible considering their inability to focus. DDD is currently allowing us to bill for 100% and has put in a system where we would have to give back 50% of the billing we receive from Medicaid, since they, meaning DDD, giving us 50%. Big problem is that they have not developed flexibility in billing with CMS. We have learned that more than 20 states have received DDD Appendix K provision, which provides for flexibility in billing from CMS. For example, Kennedy Krieger in Maryland has a day rehabilitation program where if their adults are online for 1 hour, they receive percent funding from CMS. We are very concerned now that we are only operating at 25% capacity, and because of our limited ability to bill for virtual services, that we will lack the funding to sustain our programs. We understand that New Jersey has severe budget limitations due to COVID-19, but we fail to understand why DDD has not worked out with CMS for us to have flexibility in billing, as has been granted in other states, so we can ensure that we're able to maintain 100% funding. Prior to COVID-19, a number of our programs have had to fundraise up to $200,000 annually to maintain its programs. Due to no flexibility being secured from Medicaid for their 50% match, our programs are in danger. This will negatively impact the thousands of adults with the most severe disabilities who are served by our programs, and there is currently a lack of critical programs within the state. We respectfully request that you look into this matter. DDD work with CMS to receive flexibility in billing during this critical time of COVID-19. Thank you for your consideration, Dr. Bruce Ettinger. This is certainly a problem that day programs face. I'm hoping that Jonathan Seyfried can address it.
Sure. Very happy. So thank you for the inclusion in today's council meeting, and to Spectrum 360 for the thoughtful comments. As was stated in there, we, programs did close on March 17th, and we did provide and have been providing support through retainer payments, and then ultimately right now state supplemental payments. The federal government put a limit on the amount of time, meaning 90 days that retainer payments could be provided, a federal match for retainer payments. So as it was said, we did give 100% through the end of March, and then from April through July 17th, which since day programs operate Monday through Friday, that 90 days was really, 3 6-week intervals, so it was basically 18 weeks. So that sunset on July 17th. And then since July 18th, we've been providing the full amount available to us without a state share, without a federal match, rather, which is the 50%. We have worked with CMS related to flexibilities within our Appendix K, and we continue to do so. Some of the examples that we even did recently around remote services were previously they were relegated to daytime hours for remote services. So we did expand that to be outside of daytime hours so people could get that in the evening or at other times. So we have done flexibilities there, and we are engaging with our federal partners related to more flexibilities. There are some nuances, like every state runs their waiver programs a little bit differently. New Jersey, we moved to the fee-for-service model, as the letter stated, and it's 15-minute increments. In terms of programs that get paid on a daily rate, there is, some flexibility to redefine the service. So in other words, in addition to whatever you're doing, you do a wellness check, something like that, and you can, bill for a full day. The thing that we're working out right now is seeing what kind of flexibility we have, because we are in a 15-minute increment system. And that in and of itself isn't necessarily the barrier. The reality is the funding is within each person's individual budget. So if we did create a system, we are, engaging in these conversations related to if somebody bills for, an hour of services, could they actually receive payment for more? That money comes out of the individual budget. So for some families through the pandemic, they have opted to receive self-directed services or other services and have allocated that money in other ways. So, that's another nuance to it. But it is something that we do hear our partners in the day program community, and are looking to see what kind of flexibilities we can have, and are continuing those conversations with our federal partners. We did earlier this month on September 3rd issue guidance that day programs could elect to reopen as early as this past Monday. We received about 45 attestations from providers so far of their intent to reopen. So in addition to the 50% match that could be provided, that is being provided, the state share, we're calling it the state supplemental payment, agencies can also bill for remote services. And if they elect to open in-person congregate day, they could bill for that. So we are trying to introduce more funding streams related to, in addition to remote services. We recognize that due to the underlying healthcare needs of individuals, there could be some day programs, and perhaps the agency that wrote this particular letter is in that situation where they serve the majority of people with underlying health conditions. So in-person congregate service isn't something they're yet ready to offer, but it is a flexibility that we are putting in. So in short, we do hear this as being a challenge that our partners are encountering, and are looking to see what we can do to, be flexible while still maintaining, the integrity of the system for the individuals.
Thank you, Jonathan. You mentioned that some individuals would be using the day have part of their budgets for self-directed services. Is it possible to ask people who are participating with their DDD day program provider if they would be willing to give up the full day?
That's part of the conversation that we're having with our federal partners. It's different if a system was a program, and I don't know about Kennedy Krieger, but I know in New Jersey on the medical side of things, the Medicaid side of things, a daily rate program, it's a little bit different. Plus, I don't think either. I know that in New Jersey, the medical on the Medicaid side, I'm not sure about Kennedy Krieger, but I don't believe that funding actually comes out of an individual budget for the person. I believe that is kind of a higher level state, kind of a thing where it's all behind the scenes. So every state's a little bit different in how they've implemented their waiver programs, which is why it's difficult to do an apples to apples comparison with what other states have done. But that's one of the things that we're trying to work out and get clarity on from our federal partners.
Thank you. Todd has a comment. See his hand up. Todd, you have to unmute. Okay.
Me unmute again. John, the reason why I'm asking this is because Bancroft has not even asked us when we're going to be opening. When are we going to be opening for day program? A lot of people have been asking me about that, and I'm getting a little bit annoyed with it too. And I want to go to day program. Plus, we got the special thing coming up in October. It's like 4 days after my birthday. It's our senior prom where we're all getting up, dressed up really nice in our outfits and everything. And that's going to be a special event for us. But I wanted to ask about when we're going to have our, when are we going to be able to open up our program?
Well, thank you for the question, and it sounds like a wonderful event that you're going to be having in October, and happy early birthday. So in relation to Bancroft, I would really have to reach out to Bancroft specifically. Every agency's approaching things differently and methodically. So I'd have to see exactly, I'm not sure exactly which program you attend, but I'd have to do some targeted work to really give you a good answer to that. I'm not sure exactly if Bancroft's focusing on certain areas of the state, certain programs, so on and so forth, but it's something that we could certainly look into.
It's our day program at the Flickr Center where I'm living at.
Okay, I can see what I can.
People have different programs, like we have Jacob Schaefer Center, we have we have a lot of different centers, and I'm just curious about for our center, because we got 36 individuals that are here. We got 6 individuals in each house. There's
Okay.
5 or 6 houses in each of our houses, and we're trying to find out when we're gonna get together. That's why I'm doing this, not just for me. I'm doing it for everybody.
Hmm. Yeah, I can see. I will look into that and see if I can get what kind of an answer I can get you. Thank you for the question.
I know that some day programs are giving an estimate of when they expect to reopen. My sons, they're saying either October 12th or October 19th. And they've also explained what they're going to be doing between now and then to reconfigure the space to ensure social distancing and safety. I guess the best thing is to contact specific program providers and ask them when they expect to open and how they're preparing for it. But everybody will have to do it their own way. Thank you very much, Jonathan. I'm
This
going.
is Kevin, the vice chair. I just wanted to say, as far as advocates go, this is one of those times where we have to learn patience and just kind of go with the flow and adapt as we have before, because there is no straight answer to anything. As Jonathan stated, everybody's going to have to deal with it as best they can.
Yes, I mean it is a significant undertaking. I mean, I was extraordinarily pleased that Spectrum for Living opened all their day programs on Monday. I know there were a lot of things that we wanted to do that we couldn't afford to do, but we did the best we could to safeguard the health of all the participants. I'm going to skip down a little bit because I just received notification from Jacinta that we have a quorum. So I want to get to the two items that require a quorum, and then we'll go back to the State Plan Committee. Mercedes, do you want to present the budget for approval?
Absolutely. So in the packet of material that was sent to you by Jacinta was the budget for the fiscal year beginning October 1st. I'm hoping that all of you had the opportunity to review that. The revenue for the federal revenue is based on last year's revenue, given that we will not have a budget number for fiscal year 21. There will be a series of continuing resolutions on the budget. So we don't expect to have a number, but this is the same process we followed last year in providing the prior year fiscal award to get a budget approved. So if we could move that forward, that would be great.
Okay. Does anyone have a question? And if not, will someone move to accept the budget?
Mercedes, I'll move to accept the budget as presented.
Thank you, Bill. I need a second. Anyone just unmute?
This is Helen. I'll second it.
Thank you, Helen. Okay. Let's please just raise your hand to signify a vote of aye. Okay. Can you see the hands up, Jacinta?
I can see them, but some people are not on camera.
Yeah.
I would need Elizabeth, Andrew, Kim, Kevin, and Peg off camera or indicate in
Kim,
the chat.
Kim's hand is up. Thank you, Kim.
My vote is to abstain. This is Kevin Nunes.
Hi, Paul. It's Elizabeth. I vote yes.
Thank you, Elizabeth.
You. Peg? Andrew?
Or yes,
Okay,
it's Peg.
Thank you, Peg. Andrew votes yes.
Kara is in class, so she may not respond.
Do you have enough votes? I gather.
I do. I
do.
do. I have enough.
Okay, fine. That passes. Okay. Now we have the March and August minutes to approve. Those were sent to everybody for your perusal. Does
I'm
anybody?
sorry, Paul. Paul, it's
Yeah.
not March. It's
It's
May.
May. I noticed that this morning when I looked at it, but I didn't cross it out and put in May. The May and August minutes. We did not have a March meeting. Okay, I will entertain a motion to pass the minutes for for May and August. I will cross this March out.
Paul, it's Elizabeth. I'm happy to second that.
Thank you.
Thank you very much. Okay, let's do the same vote. If you would just raise your hand so Jacinta can see to signify a vote of aye. Myself, Helen, Joyce, Todd, Bill, Jonathan, Andrew, yes.
Elizabeth, yes.
Elizabeth, yes. Thank you, Elizabeth.
Thank you.
Peg is in the chat as yes as well.
Oh, great. Thank you, Peg. Kevin Nunez, yes.
Thank you.
Okay, do we have enough?
We do.
Okay, that's great. I guess I'm on a roll here, so maybe we should. Jacinta, can we do the election while we have the quorum?
Yes, we can.
Okay.
So you'll just give me a few seconds to bring it up. Then folks will go ahead and participate. I'm assuming it will show up on your computer near the chat. You will cast your vote, and I'll be recording that vote as well.
Okay.
So give me a few seconds to pull it up. In the meantime, you can take any more nominations.
Okay.
Was everyone able to read all three statements that were issued this week? Or should we go back and